So mouth breathing, what's the problem with that? We know that that is what we call the adenoid facies, from protracted, long-standing mouth breathing. As Simon said, the bones are just living concrete and they will move if there's enough pressure put on them. The only thing, as far as I know, that doesn't deform is a diamond. But everything else, if you put enough force on it for long enough, it will bend and move and distort. Okay. So what are we looking at? Again, these are all things that you are very, very well familiar with. Venous pooling around the eyes, the dry lips, the open mouth posture, dental hygiene issues, dental wear from bruxism. Then I have tongue mobility issues. You're going to be looking at the mandibular plane and you're going to be assessing their facial growth. And what's the problem here? The problem really is these distracting forces. They're going to be pulling their face. And the analogy I give people, which the parents usually understand, is you go to a kid's party and you've got those little balloons that they wrap into little doggies and various funny shapes. They all know that. And I said, what happens when you pull on those thin balloons? And they said, it gets thinner and it gets longer, doesn't it? And then that really just reinforces in their mind, I find, what is happening to their kid's airway if it's constantly being pulled this way. Okay. The other analogy I give people is if you're a cyclist and you've got a headwind, that's hard enough to be cycling into the wind. But when you've got a crosswind, it's even more dangerous and more difficult. And again, I think sort of consolidates what I'm trying to say. So what's the effect of distracting forces? Well, you get facial elongation. Okay, I'm sure that Simon's already mentioned this, but your mouth opens and so your tongue drops. And so your tongue position is going to be lower and you're going to get palatal arching and narrowness and you're going to get dental alignment issues as a consequence. And the really big thing that I think has been a big game changer in the last 15 years is that dentists pick up bruxism. They pick up dental wear. I don't know what I'm looking at when I look at teeth, but I know that when the dentists say this person's got a lot of dental wear, I take notice of that. All right. So why are they getting dental wear? All right. We'll go through that in a second because there's autonomic activation. And of course, we know that there's significant problems with the orthodontic results and problems of relapse and recidivism if you don't correct the airway. I was saying to Simon last night, I said, there's a buddy of mine who's a dentist, and I told him, I was coming to speak at a series like this, and he said, oh, those things, they tried them 30 years ago. They don't work, all that postural stuff. And I said, yes, they do. He goes, no, they tried them and they didn't work. They relapsed. I said, yeah, but that's because they didn't fix the airway 30 years ago. Now, this whole breed of dentists are being trained to realize that, in fact, there's this huge symbiosis between what we do and what you do, okay? And that when you fix the airway, the whole game changes, but they're thinking about things that are 30 years old. And who does things now that they just did exactly the same 30 years ago? I can tell you that we don't. So the other analogy I give, because I like to sort of get a bit of flourish when I speak to people, is the manual car analogy for deoxygenation. So when your oxygen levels go down, your brain does not like it. Okay, it objects. It's got chemoreceptors. Okay, when the oxygen levels drop, the brain gets stressed. You secrete adrenaline and other stress hormones, and that has effects on your sleep, on your quality of sleep, but also on your teeth. Because when you're stressed, you clench. All right? When you've got a tiger let out of the cage and it's running against you, running up to you, you're not relaxed. You're stressed as. And so apnea is basically stalling of that manual car where the clutches come out and it's stalled. Okay. So the apneics don't get the bruxism, but the deoxygenators, I find, they get in the bruxism. That friction point, the car's rattling, okay, and that bruxism is a reflection of that deoxygenation. Would you agree or not agree, Arinda? Yeah, I mean, I sort of made it up myself, so I don't really know if it's true, but it seems to be a reasonable and logical explanation of what's happening. Because again, I don't have dental pedigree, but I've got airway experience. So what do we want from nasal breathing? What do we know? We've known for years, for decades, probably a couple of centuries, that when you nasally breathe, you warm, you filter, and you humidify. We've known that for yonks, okay? What's been a real game changer, and I'll go, well, actually, I'll just mention this here. The mouth breathing, the problem we also know is that you get asthma exacerbation, greater propensity to low respiratory infections, and you get a lot more pharyngeal irritation. But we also know that nasal breathing causes the tongue to be up against the maxilla and to expand in an outward direction, hence the possible changes. And with the mouth breathing, the tongue is going to fall down, it's going to cause palatal arching, you're going to get more dental overcrowding, occlusion issues, facial shape problems, and we tend to have, in those patients, lower cheeks and flatter faces.